The impact of COVID-19 has left family members with loved ones in mental health institutions worried. They've not been able to visit them since the lockdown started.
As family members, we haven't been able to see our loved ones for the past 3 months or since the lockdown kicked in, which now raises another question that if we have such a number of positive cases reported, were institutions actually taking precautionary measures?
Families also fear that their loved ones are not being kept safe.
When I was told, I started asking relevant questions, but sadly, I couldn't get the answers that I was looking for. The answers I got was, we don't know, we don't know, we don't know. And that doesn't help anyone. And if you get such answers, it actually raises concerns. It starts panic amongst family members. And when we get the reports that there were members that were actually told that no, their mental health patients were okay, when actually they were not okay. They've been sent to hospitals for treatment and they've passed on. Now it has raised a lot of concern because this is the same way and the same route that we went through with the Life Esidimeni situation.
67 COVID-19 cases have been recorded at 3 government facilities and 3 contract facilities.
The Gauteng Department of Health is closely monitoring COVID-19 cases at both departmental-run mental health facilities and contracted facilities. The department has 4 specialized mental health facilities, namely Vesco, Sterkfontein, Tara, and Kalinen. The Gauteng Department of Health has additionally contracted Life Esidimeni Healthcare, Waverley and Banning Care Centers, and Phoenix Health Group at Solomon 6 Morel Hospital to provide care, treatment, and rehabilitation to chronic mental health care users in the province.
A member of the Life Esidimeni Family Committee has also raised concern.
Based on the fact that they are vulnerable and at a higher risk. So the concern then is, are they getting the treatment that they deserve? Are they being protected from contracting the COVID-19? Because if they are vulnerable, it means they stand a higher chance of one, not recovering or possibly even dying from COVID-19. So our concern is the department taking all the necessary precaution to protect them? The department needs to report on mental health facilities as often as they do about everything else.
Mental health experts say patients need proper support.
Family members can end up being depressed or being more anxious. They will also benefit from therapy from themselves or support, but also the reassurance from the hospital to know that their loved one is in a better care, that will be able to help them once they know that there is transparency and open communication between the facilities and the families. That will be able to help them not to panic a lot, but to know that everything is under control and they will be able to adapt and adjust to this difficult situation.
The South African Depression and Anxiety Group says communication is key.
From the families reading about the spike of cases in the press and media and not having communication or access to understanding what is going on, what is happening, is it their loved one, how are they doing today, it's been really difficult because they can't physically see them, they can't understand what's going on, they can't know if they're okay. And I think it's just about increasing communication and urging those facilities to be able to communicate to families, let them know what is happening, what protocols and procedures are in place and how complicated the system is. I think just to help allay anxiety.
Meanwhile, more than 90 patients have been admitted to the Nasrec quarantine site in Johannesburg.
The Nasrec Expo Center, which is also a quarantine isolation facility for the department, has started taking COVID-19 cases as of the 15th of June. To date, the Expo Center or the quarantine isolation facility has over 90 cases currently based at the facility. The quarantine isolation facilities across the province are meant to assist Gauteng citizens that are not able to quarantine or self-isolate at home.
On Friday, Gauteng had over 31,300 COVID cases and 149 deaths. Nozintombi Mia, SABC News, Johannesburg.
Well, Dr. Mvuyiso Talatala is a psychiatrist at Dr. S.K. Matseke Memorial Hospital in Soweto and the former president of the South African Society of Psychiatrists. He joins me now to chat about the burden COVID-19 puts on mental health patients and South Africans in general. Thank you so much for being with us, Doctor. Let's start. I mean, we were hearing there of psychologists and psychiatrists testing positive themselves along with patients. In your own amongst colleagues, amongst fellow doctors, is there huge anxiety right now?
Thank you very much for having me. This is actually a very difficult time for all of us, especially for the healthcare workers, because they are also at the risk of testing positive. I mean, especially the nurses and the healthcare workers who are actually treating the patients. They're at high risk of testing positive. There is fear of contracting the disease, and yet there is also a commitment to look after the patients themselves. It gets even more complicated with patients with severe mental illness who are in institutions. So at risk of contracting the infection, even if they are still in the institution, and it may be very difficult to contain the illness once it gets into an institution.
Yeah. And I mean, this cuts across nurses, other healthcare workers as well. Do you expect to see an increase in mental concerns amongst healthcare workers as this pandemic intensifies in South Africa?
It is almost expected, even in the previous pandemics, although there were previous epidemics. If you look at the first SARS virus in early 2000, the healthcare workers presented with post-traumatic stress, depression, anxiety, poor sleep, because apart from the fact that they fear getting the disease to themselves, there's also the added burden, that they may take the infection and infect their family members. So there's that guilt that goes with it. And the illness itself, I mean, as the virus spreads, especially this one, unlike the previous ones, or even unlike HIV, it spreads so fast and it infects people so quickly, and the hospitals may become overwhelmed, and the healthcare workers may have to choose who gets the oxygen, who gets the ventilator, who gets what kind of treatment. They may not be delivering their work in the way they would have normally done if there was no pressure of the volume of patients coming to them.
Yeah, terrible choices to be made. And do you think that there is enough support for carers?
It's a war situation. I think we'll be able to reflect on that better after we've defeated this illness. So whatever I'm going to say, that may not be entirely true. There is some level in terms of us as healthcare workers, as mental healthcare workers. We have established, together with South African Institution Anxiety Group, some form of support where healthcare workers can phone in for free, and they get some kind of support. But the lack of PPE and in some provinces, and at some instances where you find healthcare workers complaining that they are not being supported through PPE, or there's too many patients, or that the healthcare workers may feel not supported by the state in those situations.
Yeah.
But I think we'll be able to reflect better after the epidemic.
Then tell us what you're noticing on the ground, perhaps amongst your patients even. I mean, for somebody who has anxiety already, say, COVID-19 comes along, what does that mean for people already struggling perhaps with mental health issues?
It's more devastating for people who already have mental illness. Firstly, it's going to make their conditions worse, because all of us are anxious about this disease. We all fear death and its complications. But also, in addition to that, even the interventions to deal with it, including the lockdown, for instance, although it was to flatten the curve, but it leads to isolation. It leads to other things that could make one feel depressed or anxious. And the ones with severe mental illness who may be in the streets, especially during the 5-week lockdown, were at risk of being abused by police, because the police may not understand them why they're in the street and breaking the lockdown regulations. They themselves may not have been aware of the lockdown regulations, or not being able to process that.
Doctor, finally, I mean, for South Africans who are maybe sitting there thinking, I'm physically okay, I don't have COVID-19, but there are these extra stresses weighing me down. I mean, what are the signs when you know that perhaps you should be looking for help, not about COVID-19, but about your mental health?
Yeah. Most people are going to have some kind of, are going to be affected in one way or the other in terms of their mental health. And I think people should consult, and families should support each other, even though it's called social distance. It doesn't mean we must distance ourselves from each other. And some of the early signs is the anxiety, the heart beating fast, the lack of sleep, the sadness. Those should worry you that maybe something is going to happen. You must immediately consult and get some assistance.
All right, thank you very much for your time tonight, Dr. Mvuyiso Talatala, psychiatrist at Dr. SK Matseke Memorial Hospital in Soweto. All right, so the worst is coming. The health minister has warned South Africans to brace themselves